There is a food sitting in millions of kitchens right now that most people would never suspect could harm their heart. It is not red meat, it is not butter, and it is not cholesterol. Yet recent research suggests that consuming certain everyday processed foods may increase the risk of serious cardiovascular events by more than 40%, even in people whose cholesterol numbers appear perfectly normal during routine checkups. That is what makes this so concerning. Many people over 60 believe they are doing everything right. They follow their doctor's advice. They avoid foods they were told were dangerous. They try to choose products labeled healthy, low-fat, or heart-friendly, and still heart disease continues to rise. In many cases, the real problem is not the foods people think are harmful. The problem is the foods that appear safe, convenient, and even beneficial. These foods often contain hidden sugars, refined carbohydrates, and highly processed ingredients that can quietly disrupt metabolism, increase inflammation, and slowly damage the inner lining of blood vessels over time. The most troubling part is that these products are extremely common. Many older adults consume them every single day without realizing the potential impact on their cardiovascular system. If you are over 60, the information in this video may completely change how you look at some of the foods sitting in your kitchen right now. And by the end, you may discover that one simple change in your daily routine could make a meaningful difference for your heart. Because today, we're going to uncover 9 common foods that may be silently putting your cardiovascular health at risk. Before we go any further, let me briefly introduce myself. My name is Dr. Javier Morales, and I specialize in the health and well-being of older adults. Over the past 15 years, I have worked with thousands of patients over the age of 60 who were trying their best to protect their hearts. Many of them followed every piece of advice they had been given. They avoided foods high in fat. They took their medications exactly as prescribed. They went to regular checkups and carefully watched their cholesterol numbers. Yet despite all of that effort, many of them were still developing signs of cardiovascular disease. Some experienced rising blood pressure. Others showed increasing levels of inflammation in their blood tests. And in some cases, patients who believed their heart health was stable suddenly faced a cardiac event that seemed to come out of nowhere. When I began looking more closely at their daily habits, a pattern slowly started to appear. It was not always the obvious foods causing the problem. In fact, many of the foods contributing to these issues were items people had been told were healthy choices. What many people do not realize is that after the age of 60, the cardiovascular system becomes more sensitive to metabolic stress. Blood vessels gradually lose some of their natural flexibility. The body becomes less efficient at regulating blood sugar, and inflammatory responses can become easier to trigger. When certain highly processed foods are eaten frequently, they can push these systems even further out of balance. Hidden sugars may spike blood glucose. Refined carbohydrates can strain insulin regulation. Highly processed ingredients may contribute to chronic inflammation that slowly damages the inner lining of arteries. Over time, these small stresses can accumulate and increase the risk of serious cardiovascular problems. That is why today I want to walk you through 9 everyday foods that may appear harmless, but could quietly be placing extra strain on your heart. Now that we understand how certain foods can quietly stress the cardiovascular system, let us begin looking at some of the most common ones. We will start from the foods that may seem relatively harmless and work our way toward the ones that can have the greatest impact over time. Number 9 on our list is breakfast cereal. For decades, cereal has been marketed as a healthy and convenient way to start the morning. Many boxes highlight whole grains, vitamins, and heart-friendly claims. But when you look at the ingredients, most breakfast cereals are made from refined grains that digest very quickly in the body. Many also contain added sugar. When these refined carbohydrates break down, they cause blood sugar to rise rapidly. The body responds by releasing insulin to bring those levels down. If this pattern repeats day after day for years, the body can gradually become less responsive to insulin. This condition, known as insulin resistance, is closely linked to inflammation and cardiovascular disease. I remember a patient named Margaret Thompson, a 72-year-old retired school principal from Seattle. She believed her breakfast routine was healthy. Every morning she ate cereal with low-fat milk and a glass of fruit juice. But her blood tests showed rising inflammation and increasing blood sugar levels. When we replaced that breakfast with eggs, avocado, and berries, her markers began to improve within a few months. Number 8 is fruit juice. Juice often appears healthy because it comes from fruit, but when fruit is turned into juice, most of the fiber is removed. Fiber normally slows the absorption of sugar in the body. Without it, the natural sugars in juice enter the bloodstream much more quickly. This can lead to repeated spikes in blood sugar and insulin, which over time may contribute to metabolic stress and increase cardiovascular risk. Number 7 on our list is low-fat processed food. Beginning in the 1980s, many products were reformulated to remove fat, but to maintain taste, manufacturers often added sugar or refined starch. These ingredients can raise triglyceride levels, increase inflammation, and disrupt blood sugar regulation. And when these effects accumulate over many years, they can quietly place additional strain on the heart and blood vessels. Let us continue moving through the list. Number 6 on our list is flavored yogurt. Yogurt has long been associated with good health. It contains beneficial bacteria and important nutrients such as calcium and protein. But many of the flavored yogurts sold in supermarkets today are very different from plain yogurt. To improve taste, manufacturers often add large amounts of sugar. A single small container can sometimes contain as much sugar as a dessert. When sugar is consumed frequently throughout the day, the body begins producing higher levels of triglycerides in the bloodstream. Elevated triglycerides are closely associated with cardiovascular risk because they contribute to plaque buildup inside arteries. For older adults whose arteries are already becoming less flexible with age-repeated spikes in blood sugar and triglycerides can quietly accelerate vascular damage over time. Number 5 is processed snack foods. This includes items such as microwave popcorn, packaged crackers, and many shelf-stable snack products. These foods are often produced using highly refined vegetable oils and a long list of additives designed to improve shelf life, flavor, and texture. Many refined oils contain large amounts of omega-6 fatty acids. While the body needs small amounts of these fats, consuming them in excess compared to omega-3 fats may promote chronic inflammation. Inflammation plays a central role in the development of atherosclerosis, the gradual buildup of plaque that narrows arteries and restricts blood flow to the heart. Additionally, many packaged snacks contain high levels of sodium. Over time, excessive sodium intake may contribute to elevated blood pressure, which further increases cardiovascular strain. Number 4 on our list is instant oatmeal. Oats themselves are widely recognized as a heart-healthy food. They contain a type of soluble fiber called beta-glucan, which can help support healthy cholesterol levels. However, instant oatmeal packets are often heavily processed to cook faster. This processing breaks down the natural structure of the grain. As a result, the carbohydrates in instant oatmeal are absorbed more quickly in the body, leading to faster rises in blood sugar. Many flavored varieties also include added sugar. When blood sugar rises rapidly and repeatedly, it can trigger hormonal responses that place additional stress on metabolic and cardiovascular systems. For those who enjoy oatmeal, a better option is choosing steel-cut oats or traditional rolled oats, which digest more slowly and provide more stable energy. We are now approaching the foods that may have the greatest long-term impact on cardiovascular health. Number 3 on our list is diet soda and artificially sweetened beverages. Many people switch to diet drinks believing they were a safer alternative to sugary sodas. After all, they contain little or no calories and no sugar. However, emerging research suggests that artificial sweeteners may affect the body in more complex ways than previously believed. Some studies indicate that certain sweeteners can alter the balance of bacteria in the gut. The gut microbiome plays an important role in metabolism, inflammation, and how the body processes glucose. When this balance is disrupted, it may interfere with normal metabolic signaling and potentially increase the risk of insulin resistance over time. Although diet drinks may appear harmless, frequent consumption may place additional stress on the body's metabolic systems, particularly in older adults whose regulation of blood sugar may already be more sensitive. Number 2 on the list is commercial bread and refined grain products. Many breads on supermarket shelves carry labels suggesting they are made with whole grains, but in reality, a large number of these products still rely heavily on refined flour and added ingredients. Refined grains are rapidly converted into glucose during digestion. This can trigger repeated increases in blood sugar and insulin levels. In addition, many commercial bread products contain industrial seed oils and preservatives designed to extend shelf life. Over time, frequent consumption of refined carbohydrates combined with processed oils may contribute to chronic inflammation and metabolic imbalance, both of which are associated with cardiovascular disease. And finally, number 1 on this list is ultra-processed convenience meals. This category includes many frozen meals, packaged dinners, and meal replacement products that are marketed as quick solutions for busy lifestyles. While these foods may be convenient, they are often built around refined grains, industrial oils, high levels of sodium, and various additives designed to improve texture and flavor. I once worked with a patient named Elaine Parker, a 75-year-old retired nurse from Phoenix. She believed she was making responsible choices by eating frozen diet meals that clearly listed their calories and nutrients, but when we examined the ingredients more closely, her daily meals contained large amounts of refined carbohydrates, processed oils, and additives. After gradually shifting her diet towards simpler whole foods such as fish, vegetables, olive oil, nuts, and fresh ingredients, her inflammatory markers improved, and she reported having more stable energy throughout the day. Sometimes the most powerful change for heart health is not adding a special supplement, but simply returning to real food. We have covered a wide range of everyday foods today. From breakfast cereals and fruit juice to flavored yogurt processed snacks, instant oatmeal diet drinks, commercial bread, and ultra-processed convenience meals, many of these products appear harmless at first glance. In fact, some of them have even been marketed for years as healthy choices. But when these foods become daily habits, the hidden sugars, refined carbohydrates, and heavily processed ingredients inside them can gradually place stress on the body's metabolic systems. Over time, this stress may contribute to inflammation, unstable blood sugar, and strain on the cardiovascular system. As a physician who has spent many years working with older adults, I have personally seen how small dietary changes can make meaningful differences in people's health. Many of my patients did not need extreme diets or complicated routines. Often the most powerful improvements came from simple adjustments, such as replacing heavily processed foods with more natural whole ingredients. In my experience, the goal is not perfection, it is awareness. Once people understand what is really inside many packaged foods, they can begin making choices that better support their long-term health. At the same time, it is important to remember that the information shared in this video is intended for educational purposes. Every individual's health situation is different, and this video should not be considered a substitute for professional medical advice, diagnosis, or treatment from your own healthcare provider. If you have concerns about your heart health or your diet, the best step is always to speak with a qualified medical professional who understands your personal medical history. If you found this discussion helpful, consider sharing it with someone who may benefit from hearing it. And I would like to leave you with one simple question. Which of the foods we talked about today surprised you the most, and which one might still be sitting in your kitchen right now? Your answer may encourage someone else to start making healthier choices as well.